Good afternoon, the moment I've been waiting for all day. Welcome. Welcome to the College of Nursing White Coat Ceremony. I am Mary Tobin, Associate Dean for Undergraduate and Master of Science Entry into Practice programs at the college. I would like to make a few announcements before we begin the ceremony. One, out of respect for our students and guests, please take a moment to silence your cell phones or other noise-making devices. And for everyone's safety, please refrain from taking photos from the aisles or right in front of the stage. We have a professional photographer taking pictures of every student, and we will have them available for you to download at no cost. Thank you. We appreciate your cooperation. We are so pleased to recognize our students in the Bachelor of Science in Nursing program, and we are delighted that so many families and friends could gather for this very special event. Joining me in the ceremony are Dr. Kimberly Hunter. She is Chief Nurse Executive at the University of Iowa Healthcare. We have College of Nursing Clinical Professor Dr. Anita Nicholson, and College of Nursing Associate Professor of Instruction, Dr. Teresa Bechtel. Also with us are several staff and faculty from the College of Nursing. Please stand and be recognized. Special thanks to Robin Heiken and Ryan Vaughn with Hands Up Communications for ASL Communications. Throughout history, we as nurses have been the forefront, leading the way through uncharted territories. This is what the nurses before us did in the Crimean War, the 1918 flu epidemic, the AIDS epidemic, to name a few eras of uncertainty. It is what nurses of today did during the COVID-19 pandemic. And it is undoubtedly what the nurses of tomorrow will continue to do. As nurse scientists, nurse leaders, and healthcare professionals, we are on the forefront every day when we go to work, be it in the hospital, a research lab, a community health clinic, here in Iowa, across the United States, or across the world. This afternoon, we are honored to recognize this event marking your nursing journey, the beginning of your clinical coursework. During the next 2 years, you will learn from faculty who are nationally recognized experts in their fields and work at a renowned academic health center. Through a combination of didactic, simulated, and clinical learning experiences, you will learn to practice with diverse populations across the lifespan, focusing on the 4 spheres of care: promotion of health, well-being and disease prevention, chronic disease care, regenerative and restorative care, and hospice, palliative, and supportive care. You will gain competencies in the increasingly important areas of person-centered care, population health, quality and safety, research, systems-based practice, informatics, health technologies, and leadership. While you are here, you will have the opportunity to stretch who you are as a student and who you are as a person. I encourage you to embrace these opportunities. We are honored that you have chosen the University of Iowa College of Nursing for your nursing education, and we look forward to journeying together with you along your path to professional nursing. I would like at this point to introduce Dr. Kim Hunter. It is my pleasure to introduce Dr. Hunter. Dr. Hunter joined University of Iowa Healthcare in April of 2021 as Chief Nurse Executive. She leads the Department of Nursing Services and Patient Care, providing administrative oversight to nursing services, care coordination, rehabilitation therapies, and respiratory care. She also serves, and we thank her, as Dean of Clinical Practice at the College of Nursing. Dr. Hunter earned her Master's of Science in Nursing and Baccalaureate of Science in Nursing at the University of North Carolina in Chapel Hill. and a Master's of Business Administration at the University of Tennessee in Knoxville. In 2017, she earned a doctorate of nursing practice in health systems leadership from Chamberlain University. Dr. Hunter is credentialed by the American Nurses Credentialing Center as a nurse executive, advanced board certified. Please join me in welcoming Dr. Kim Hunter.
Thank you, Dr. Tobin. It's so good to see all of you. Someone was saying, well, thank you so much for being here. I'm like, oh my gosh, this is like the best part of my day, right? Everybody's so excited, happy, energetic, and so many proud members of your family and your extended family and friends. So it's my pleasure to be here with you. So I want to thank you, Dean Tobin, all the faculty of the University of Iowa College of Nursing, all the guests, the family, the friends, and then most importantly, all of our newest cohort of the BSN students at the college. I'm really happy to be with you. This is like a really big day. You know, through different times that I've been in school, they'll say sometimes like, okay, look to your left, look to your right, kind of remember this day because it's going to go by in a flash. And you're going to be graduated. And I would say that's true. So in any case, enjoy this ceremony for you. I also know that it's so important and exciting as a parent. I am a parent, but I know it's exciting as a family member and friends for you to be here and recognize your loved ones and all that it's taken to get them to this point. I know you're very, very proud, and it's a big day. So you enjoy the ceremony too. So, you know, this is really a transition for you, right? Dr. Tobin talked about that just a little bit. It's a transition that's, you know, new. You're going to be coming up here and putting on a white coat. That's like really exciting. Like that really makes you feel official, makes you look the part. It's kind of neat, right? But enjoy it. And you're going to be wearing that coat a lot. But it's a symbol too of this new start. And you know, probably you might even feel a little something different, like, wow, I look different, and there's responsibility that goes with this, and I think that that's important. I mean, you're a professional, right, and in the nursing profession. So over the next couple of years, you're going to be going to school and doing clinicals and all types of things. You know, people talk about nursing being an art and a science, and there's so many subjects you've already taken in school. And by the way, you're really smart, or you wouldn't be sitting in the audience, right? It's a really competitive program to get into, so feel very proud of yourself. But you've learned a lot of subjects, and then your next couple of years will help you take that subject matter that you have and apply it to patients in real life situations and start to help you get that hands-on experience that's probably, I mean, it's skills and then it develops more into an art. And so I think that when you're a speaker at an event like this, people don't want to listen to you too long, right? And like, what do you say, right? What could be impactful? And so I just want to share a few things. So rather than talking about some philosophical thing about nursing and healthcare, which has its place, I went around to nurses in our organization at UI Healthcare to say, gosh, if you were going to give advice to a new nursing student, what would it be, right? You've lived through this, what would they say? And so that's what I'm going to talk to you about, okay? And so one of those things, there were some themes that emerged in the discussion with those folks. And one of the things was, well, what skills should you develop or will you develop? And so one is organization. Some people are better organized than others, but we all, through nursing school, get better organized than where we started from because that's part of our role and helps us take care of patients. Time management is also another thing, and you'll get better at that. There's a lot you're going to need to be patient with yourself in school, and I'll tell you a story about that in a second. But you got to take care of yourself too, they say, right? Your physical health and then your mental well-being. You're going to be pressed for time and you've no demands of school and you're high achievers anyway, but you've really got to take time to fill your cup with things that are important to you, that give you, some love, some satisfaction, some happiness too. Balance it all out as best you can. Another thing they say is listen and observe, right? You're not going to go in knowing everything. The more you listen, the more you observe, the more you ask questions, you're going to really learn from that. And that's not just from other nurses, but other members of the healthcare team. And then another thing they say is focus on the end result and just keep moving forward because you're going to get there. Another theme that emerged is about exploration, like what should you explore? And so they say, there's so many opportunities to nurses. It used to be back in the day, you'd be a nurse and you could work in a hospital or maybe a clinic. The world is wide open to nurses now. There's so many opportunities to work as a nurse and use your skills, and that's really fun. And so you've got the opportunity to explore different opportunities, different options out there, different clinical experiences to see, well, kind of what fits you, what's your fit, what's your passion. For me, it was pediatrics. I was going to be a cardiac nurse, worked the summer between my junior and senior year in a cardiac ICU. I thought, this is it. Lo and behold, come final semester of school, I had my pediatric rotation. I'm like, oh no, this is it, right? And still to this day, love that part of nursing too. So you'll explore different things and you might even change your mind. Some people talk about use your summer and weekends to try out many different types of nursing, different kind of experiences you may get involved in. And then too, there are nursing organizations that students are a part of. And so get involved with that too. That's another great thing to do. This, I think, is really important. And if you talk to people that I work with, I think they would tell you that I'm a real people person. And so I think you have to remember that we're human, right? There's so much about nursing, so much about medicine and other healthcare disciplines. It's like we are humans and we're taking care of humans. And I think you have to keep that in mind. So take time to listen to your patients and look them in the eye. We're so focused on technology. We have all kinds, you go in the hospital or clinic and then your electronic medical record is there and people have to put things in it. You've got different devices and monitors and they integrate into the medical record, and you've got different gadgets and things you need to use and different equipment for safe patient handling, and the list goes on, right? Well, but there's a human at the other side of that. And if you've ever been the human in the bed or in the waiting room or in the clinic or in the perioperative space, like really what you really want is people that connect with you and can talk to you and answer your questions, help allay your nervousness and your fears a little bit, talk with you about, well, what could I expect? Well, what should I know about this condition? And so I think that is critical. And deliver the care with empathy, right? You may not know exactly what they're experiencing, but that empathetic care is so important. And it's hard when we're rushed, right? It's hard when we're rushed in whatever job we have, whether it's nursing or something else. But the more you can pause and take just a little time to really listen to that patient and or family member and connect with them, it will be better for you. It'll make you feel better about your role as a nurse, and it'll make the family and the patient feel better too. So human is on the other side. Always remember that. All right, another thing I say, and when I talk with new nurses that join our organization, I go to one of their orientation meetings. And one of the things, sometimes they'll say, well, what advice do you have for us? And I'm like, oh, you've got to speak up, right? So I would say the same thing to you. You are smart. You see things from a different lens, and you will be in clinical situations with people that have been working there for a year or 2 or 10 or 20, and they get used to, we all get used to that environment and what we're doing. Your insight is so valuable, right? The questions you ask, the things you might catch that maybe we didn't, are really valuable for you to mention. So don't be afraid to speak up. I think the other thing is, as you work with other nurses throughout your schooling and your different rotations, the more you engage and ask questions, people love to share, they love to teach, and they're going to be wanting to share all of that with you. And so I would say too, never forget you're not alone, right? So you don't have to have all the answers. You've got wonderful faculty members who are going to be there with you. You'll have great preceptors in your clinical areas and other members of the healthcare team to bring questions to. So always feel free to ask and call upon them. So I think that as you go through your experiences in the next couple of years, I hope you'll realize what a privilege it is to care for patients. When you think about it as a nurse, you're often the person that spends the most time of any other healthcare team member with the patient and their family. And so they'll share with you information they may not share with other people, and particularly if you develop a relationship with them. They're going to share those things. They're going to tell you what they're afraid of. They're going to ask you for guidance, and they're going to be looking for maybe some reassurance and really an empathetic approach. So you're going to be with people, and you're going to see joyous moments, right? You're going to see babies born. You're going to see, great diagnostic outcomes for patients and whatnot. And then you're going to see very sad times too, right? And you're going to share in that with the other human beings you're around. And you're going to be supporting the family members who are with those patients. And so in all of these experiences, we find ourselves as nurses kind of woven into the fabric of the lives of those people, many of whom you will never see again. You will never know the impact that you've made on them. But they're going to remember you. They're going to remember how you comforted them, how you laughed with them, and how you listened to them. And that, to me, is one of the things that makes nursing so special, and why I say it's a privilege to be a nurse. It's a privilege to support people and have the impact on them. So let me tell you, right now, actually started at 4:30, we have a patient in our hospital who's a father, and he has some medical challenges. And his daughter is getting married. And so because he's in the hospital and can't leave, we are having a wedding at the hospital right now. And so it's the coolest thing. So this afternoon, I went over to the area, and it's all decorated, and some friends of the family have come in, and it's just absolutely gorgeous. And so this is the kind of thing nurses do too. And it's not just nursing, right? The respiratory therapists, the social workers, and other members of the healthcare team are all supporting this effort so that this dad can be with his daughter while she gets married, right? And so that's like another example of what I talk about the humanness of things and the connection with people and the things you get to do as nurses that are so meaningful. So I look forward to seeing pictures of that event because it'll be really neat. And I think I would have stood there and cried the whole time had I been there to see it. But I don't know, it's just special being a nurse. I hope you can see like you've picked a wonderful profession. So I just encourage you to follow your passions, check out your options. We look forward to having you in our facilities at UI Healthcare. You'll do some of your clinical rotations with us. I think you're going to be impressed by the nurses that you get to work alongside from our organization. We're a magnet organization, and if anybody knows what that is, it really says that nurses in our organization have achieved a lot of great things. We meet a lot of great metrics, and nurses are really independent and really involved in how we believe patients should be cared for, how we do research, how we use evidence to guide our care of patients. So I think you're going to have a great time. I encourage you when you're in the hall, if I pass you, please stop me. Please, I would love to hear how things are going. I go up in different places, clinics and inpatient units and whatnot, and love to talk with students. And so I wish you all the best in your program and look forward to seeing you. And all of us at UI Healthcare look forward to working alongside you. So at this point, I'm going to turn this back over to Dr. Tobin, and we'll get to the business of sharing some more information with you and getting you to come up on stage. Thank you.
Thank you, Dr. Hunter, for sharing those very impactful words with us. As nursing has evolved, so have the symbols of our profession. For many years, students received a nursing cap, which when they completed their introductory training. A cap was a symbol of commitment to the field, and each school had its own style. Today, you receive a different, though no less significant and important symbolic identifier as you begin your nursing career: the white coat. The white coat signifies that you are a healthcare professional who is committed to caring, compassionate service to humankind. Inherent in the image of the professional white coat are the core values of altruism, excellence, caring, integrity, and respect for human dignity. Those who wear it are called to those professional values and the associated behaviors that they represent. I would like now to welcome Dr. Anita Nicholson, who will give you directions for the ceremony.
Good afternoon. It's wonderful to be here. This is such an exciting time. So students, you will be dismissed by row. Stay in alphabetical order as you approach the stage. When I read your name, you'll walk across the stage, hand your coat to Dr. Bechtel or Dr. Hunter, and stand on the X facing the stage. Once you're coated, pause for 2 seconds for a photo on stage. Our photographer will be at the top of the middle aisle, so look at the exit sign so that you'll be able to get good visualization. After you're coated, please proceed backstage for another photo to be taken. Follow the College of Nursing or the Englert staff who will direct you on where to go from there. So we will now begin the white coat ceremony. Lauren Adams. Grace Alf. Elizabeth Allure. Ryan Arceo. Julia Bartelt. Brooke Bauer. Rebecca Benton. Tess Bourne. Joella Breyer. Caitlin Brandt. Lily Brindley. Zoreya Briseno. Catherine Burke. Monica Cano. Mackenzie Carley. Kylie Costello. Taylor Cernan. Madeline Cloesy. Michaela Kraft. Alyssa DeMasi. Desiree Colette. Lauren Dudkowitz. Elizabeth Edwards. Jake Ellis. Natalie Irio. Tenley Faber. Molly Finn. Olivia Flanders. Lauren Gallivan. Morgan Gassman. Olivia Jaleo. Gina Gonya. Mairead Green. Mary Grace Guidi. Sophia Gamosio. Olivia Geyer. Tatiana Henriquez. Ryan Hoops. Alexis Howard. Jordan Hughes. Brecken Johnson. Abigail Johnson. Maria Kaducha. Okay. Catherine Kirschman. Alexa Knapp. Ava Knudsen. Paige Kolstedt. Isa Lavoy. Anna Lengel. Jaden Lawless. Natalia Lazich. Naaya Lopez. Hope Macris. Emma McLean. Allison Mazier. Mallory Mueller. Hayat Mustafa. Elizabeth Oldkowski. Excuse me. Abby Olson. Josie Parks. Sarah Perrine. Angelina Rafalski. Jennifer Rangel Mendoza. Nathan Royer. Sophie Sanidas. Cade Scheidemann. Caitlin Shepman. Kendra Schneider. Amelia Scott. Ava Scranton. Rose Sheridan. Margaret Snyder. Nicole Stanley. Ella Stevens. Murrah Sullivan. Samantha Thomas. Ava Utzinger. Kaira Van Vang. Abby Vetch. Riley Weir. Abigail Wirrell. Grayson Willis. Angel Wilson. Olivia Weissner. Okay, let's have a round of applause for those that are white-coated.
We'll wait just a minute as the remaining students return to their seats. All students, please rise. Let's give one last round of applause to our talented group of future nurses. Please take your seats. As this white coat ceremony draws to a close and you set off to pursue your professional nursing education, you are poised to acquire the essential competencies needed to provide compassionate, quality care that is patient-centered, evidence-based, and leads to improved health outcomes. We are glad to be part of your journey. Thank you all for being with us for this important milestone, and to celebrate these future nurses, congratulations and have a fabulous evening. Thank you.